Our first section is history and documentation. The review of systems is a list of questions arranged by organ system designed to uncover dysfunction and disease. It's important to understand that this question and answer of review of systems is just one piece of the clinical puzzle. The patient's responses must be interpreted within the context of the rest of their findings, including their risk factors, their past history, and their exam findings. For example, if your patient complains of shortness of breath, we would then further define this with its symptoms, including duration, precipitating events, severity, character, associated symptoms, etc. On the basis of this data, the physician can come up with an informed conclusion about the importance of this review of systems symptom and use it as a guide in their medical decision making. When taking a history on a pediatric patient, you want to ask about how the pregnancy and the birth was. Did they have a routine birth, or was it assisted with a vacuum or forceps? Have they met their developmental milestones? Also find out about their medical, family, and social history.
Visual acuity is impacted by many different factors. Large pupils allow more light to pass through into the eye, which stimulates the retina more. However, this does have a disadvantage because it affects resolution because of the optical aberrations that increase in the eye due to the increase in light. Small pupils reduce optical aberrations because less light is passing through the eye. However, resolutions are diffraction limited. Therefore, good visual acuity is a mid-sized pupil of approximately 3 to 5 millimeters. This is optimal as it's a compromise between the diffraction and the aberration limits. Visual acuity also decreases with age due to decrease in pupil size. So as we age, we typically need a higher level of illumination. Optical aberration can influence visual acuity. These are spherical errors, cylindrical errors, and other types of optical aberrations. And optical aberrations are not just tied to the eye itself, but also to any lens material that the patient may be looking through. The luminescence of a test object can influence the visual acuity. When contrast is reduced, it becomes more difficult to read it against a darker background. Therefore, the text needs to be made large in order for the illumination levels to be correct for good visual acuity. High illumination levels may decrease visual acuity because of a loss of contrast between the object and its background, or reflections on the surface of the object. The area of the retina being stimulated can also impact visual acuity. Visual acuity is greatest at the center of fixation, which is the fovea. The fovea has the greatest visual acuity due to the densely packed cones. So once the image is moved away from the center of visual fixation, visual acuity is affected. Contrast also affects visual acuity. The legibility of the test object and the patient's familiarity with the test object. Also, the space between the test objects influence visual acuity. The visual acuity 5/400 means that the patient is 5 feet from the chart and can only see the 2400 letter. CF at 1 foot means that the patient can count fingers only at 1 foot. HM is hand motions only. LP with P is light perception with projection, meaning the patient can see the light and they can tell you where the light is coming from. When checking for light perception or light perception with projection, check all 4 quadrants of the eye and notate which of the 4 quadrants the patient is LP with P, LP, or NLP. NLP means no light perception. The metric equivalent of 20/20 is 6.6. That's in meters. For pediatric visual acuities, you're going to notate whether the patient has central, steady, and maintained vision, which is annotated CSM, whether it's central, steady, and not maintained, central, unsteady, and not maintained, or not central, unsteady, and not maintained. Compound myopic astigmatism occurs when there's myopia in all meridians, but they are of differing amounts. The 2 principal meridians contain the most power and the least power, but you can find cylinder power in any meridian. Looking at the first optical cross, let's examine the prescription -3 plus 4 at 180. The sphere power, -3, corresponds to the axis 180, which means that on the 180-degree meridian, the power of the prescription is -3. No part of the cylinder is felt at this meridian at all. It is the axis of the cylinder, but not the meridian of that cylinder. The meridian at which the cylinder is felt is 90 degrees away. Looking at the second optical cross, let's see what happens in between 90 degrees and 180 degrees. Obviously, the further away from 90 degrees you go, the less the cylinder is felt, and the closer to the 90-degree meridian, the more the cylinder is felt. You can see this in the third optical cross. If you go halfway between 90 degrees and 180 degrees, you feel half of the cylinder's power. Half of 90 degrees is 45 degrees, or 135 degrees. At axis 45 degrees, or 135 degrees, the +4 diopter cylinder power of this prescription is +2. If a camera has special magnification included in the camera itself, and then you also are using magnification with the slit lamp or the operating microscope, that magnification is multiplied together to get the total magnification. For instance, if your camera has 7 times magnification and the slit lamp has 30 times magnification, the total magnification is 210 times. Videos can be recorded with a smartphone camera or a standard digital camera, either handheld, attached to a slit lamp, or an operating microscope. If the patient has trouble staying still, you can film and then later extract the still frames. However, be aware that image quality with a video is less than that of still photographs. Videos can be taken to intentionally show motion, for example in pseudophagogenesis. Phagogenesis is the tremulousness or vibration of the lens with eye movement. They can also be used to show procedures performed at the slit lamp or at the operating microscope. An ectropion is a sagging or eversion of the lower eyelid and usually occurs in both eyes. It's a common finding in older patients. Ectropion may be caused by a relaxation of the orbicularis oculi muscle, either as part of the aging process or following a severe nerve palsy. The common symptoms are tearing and irritation, and many patients develop exposure keratitis. Congenital glaucoma is caused by a malformation of the iridocorneal drainage angle. It can be unilateral or bilateral. These patients typically have large corneas, more than 12 millimeters in diameter, and the cornea is usually very thin. The typical signs and symptoms that we see in congenital glaucoma include photophobia, blepharospasms, and chronic tearing.
There are specific ways that hazardous materials must be disposed of. If something contains blood or body fluids, it must be disposed of in a red bag and a red hazardous materials impermeable container. OSHA also requires that a waterproof mat is put underneath this hazardous material container. Sharps should go in the sharps container. This is needles and blades. Make sure when you dispose of a needle in the sharps container, you do not recap it.
Demonstrating good communication skills shows respect for others. It can also garner respect for yourself. You can gain cooperation from others, set your patient at ease, and it can also limit lawsuits and nurture patient referrals. Supply management involves managing resources needed to service the patient and also managing contracts with suppliers and inventory levels so that costs are kept low. Identify a main point person to be responsible for this. Analyze historical data to identify use patterns and standardize products whenever it's feasible to do so. Monitor expiration dates for supplies which expire. Automated tools are available, such as barcode scanners, to manage stock levels. Factors to consider when selecting supplies and equipment include the need, the appropriateness of it, the quality and the cost, the source, how often it will be used and how it will be maintained and how much maintenance it will require, the material that it's made with, and whether it's disposable or reusable.